Ramadan online. Stay connected to the East London Mosque.
East London Mosque and London Muslim Centre would love to say thank you to the following businesses and charities for sponsoring our Ramadan Online 2021 programme: Islamic Relief, Untitled Aid, Global Relief Trust, Penny Appeal, Muslim Aid, Human Relief Foundation, Muslim Burial Fund, Irani Taylor Solicitors, City Realtor, AWMA Architecture.
Assalamu alaikum wa rahmatullahi wa barakatuh. My beloved brothers and sisters, Ramadan Mubarak, Ramadan Kareem. Welcome on behalf of the Community Hour, on behalf of the East London Mosque with Ramadan Online. It's an opportunity for you to benefit from Ramadan, enjoy Ramadan together as a family. Whether you're a husband, whether you're a wife, whether you're grandparents, all the children, everyone has something that they can gain from Ramadan Online with the East London Mosque. So don't forget to ensure that you like, share, comment and follow, and of course on YouTube, subscribe and press the bell icon to get notifications of new videos. Alhamdulillah, it's an honor to be in the best month of the year, which is Ramadan Mubarak. I hope everyone is well, and we are going to be talking about health today. A very, very important aspect of Ramadan in terms of looking at how we can improve ourselves. Ramadan is a time of discipline. Good health is connected to discipline. I want to bring in Dr Abdul Wadud Kamali, who is a GP in London. Assalamu alaikum rahmatullah.
Alaikum salam, Abdul. Thank you very much for inviting me, as well as the East London Mosque. It's a privilege to be here.
Welcome to the Community Hour with the East London Mosque and Ramadan Online.
Thank you.
You're welcome. So wherever you are watching from, brothers and sisters, definitely make sure that you like, share, comment and of course subscribe and press the bell icon for notifications. Now when it comes to health, there are lots of issues around health, and when it comes to talking to a doctor, often we assume that doctors become doctors, particularly within the Muslim community, because it's the parents that say, I want my son or my daughter to be a doctor. Dr Abdul Wadud Kamali, what was your reason for wanting to become a doctor?
Well, it's a good question. So obviously when we decided to become doctors, we were quite young in college, age 16, 17. My reason was mainly because you want to help people. So some of the work which I did during school and college, going to the community, doing projects with small kids, teaching kids, working with elderly people, working with your elderly parents, family, and the desire to help them is probably the reason why I wanted to go into medicine and become a doctor. And one of the things you can do by being a doctor is serve your community, serve your own people, help them and relieve the burden of disease, because we see so much disease in our society, so much suffering, and being a doctor is one way to relieve their sufferings. And as a doctor you have the opportunity to make decisions, make those critical decisions, be able to be in that position to make the decision to improve health or save lives. There's a cliche, saving lives, absolutely in certain circumstances, but not just saving lives, it's just improving lives and keeping people healthy. So absolutely, this is probably the main reason why I went into medicine.
So in terms of medicine, I know that there's so many different fields of medicine when you kind of finish your medical school and then you start deciding to specialize. Why did you decide to become a GP and not a surgeon or something else? When
one goes through medical school, one experiences different fields. So neurology, cardiology, pediatrics, psychiatry, general practice as well. And you see what inspires you, what interests you. So when I was doing medicine, surgery actually inspired me, general practice as well. And they're two very different fields. One is long-term management of the same patient over the years in a general practice in the community. And as a surgeon, you work with your hands, you fix things, so it's instant results. I went into surgery actually initially. I did surgery at the Royal London Hospital, which is based in London, did neurosurgery and other surgeries. I did actually get onto the training program to become a consultant in orthopedics. But when you do work as a surgeon, working nights, weekends, not just working as a doctor, you have to do a lot of work on publications, research, international presentations. So when that came into effect, as a single person, you can work very hard and absolutely serve your community as well. And I was honoured and fortunate to work in the Royal London Hospital, where you have which is based in East London, a deprived population, a high ethnic minority population. So I was very honoured to kind of work with them. Having said that, the reason I changed over to general practice is one of the key things you have to look at when you become a doctor is the impact on your life, and whether you can develop your other interests and essentially be happy with everything in general. As a Muslim, as a Asian Bengali, we have to look at what has been important in my life: family, religion, being able to do other things like charity work, and having the time to do that. As a surgeon, it was absolutely brilliant, enjoyed all the work, but it was difficult to balance everything. And what I felt is, if I go into general practice, it would give me the opportunity to do charity work, to engage with my community, to have time to myself as well, family, children, and my local community. So that was quite important. I guess as a surgeon, I passed all my exams, the Royal College exams, and everything, and had the opportunity to become a consultant. But I had to weigh up everything, the balance everything out, and then decide what's best, not for me, for my community, for my family as well. So this is the main reason why I then went into general practice.
Brilliant. For our audience who've just joined us, welcome. Ramadan Mubarak, Ramadan Kareem. You're watching the community show on behalf of Eastern Mosque Ramadan Online. It's your opportunity to learn as a family. There's tons of stuff online that you can benefit from as a family. So wherever you are, stay connected. It's about bringing the masjid to your house. This is what Eastern Mosque is doing this Ramadan, inshallah. So make sure you like, you share, you follow, you comment, and of course subscribe, and also press the bell icon for any notifications. Now, Dr. Kamali, often we get health advice from the doctor. What is it that you do as a doctor to keep your own family healthy?
That's a very good question. Interesting one as well. Commonly we say in medicine that doctors do very well in looking after their patients, but don't do very well looking after themselves, because they think they know it. When it comes to family, it becomes slightly different, because you want the best for your family. So when I look at my family, there's several things I look at to keep my family healthy, including my children, my other half, my wife, my parents as well, brothers and sisters. So one thing, especially with the children, one thing I try to do is avoid bringing in sweets and crisps and high energy foods, what we call junk food. So I try to avoid bringing that in from the shopping, so that isn't a kind of a routine thing or things that they have access to. So yes, you give them a treat once in a while, so I'm not making a habit. I'm quite keen on making sure their weight is controlled. So I'd rather have them slightly under than over, because one of the problems which is developing in London, England, especially amongst the Asian community, is obesity in children. And I'm very keen to kind of make sure my children are brought up without the risk of becoming obese. Thirdly, it's important to eat healthy. Exercise as well. So I make sure my children, my other half, my mum and dad are always doing some form of exercise in the garden. Obviously with lockdown it's much more harder, but in the garden, in the house, even simple things like walking around, going around the block, that's very important. Number 4, mental health is very important. So my wife works as a teacher, a stressful job. My job can be stressful as well. And all of us who are of working age, who have children, there's so many things which happen, especially with the pandemic. It's been very, very difficult for everyone. So mentally it's very important, and I always find ways to try and help them with the mental health, help them keeping them engaged, and also talk to them about this on a simple level, just to work out what they're going through. Sometimes just a simple discussion, trying to understand their side of things, the children, your other half, your parents, that really helps, because we're always focused on what we want, what's our need. But as a doctor, I think having to work with patients and understanding their needs and what they're going through helps me to identify and understand that from my family's point of view. And the other one thing I would also mention is it's important to try and train and educate your young family members about things like resuscitation. So if someone is seriously unwell, what do you do? It's a very difficult scenario, and you don't know what to do. And it can happen to anyone, whether it's your children, your elderly parents, your other family members. So if everyone knows the basics of CPR, resuscitation, then that can keep someone going. And the last thing you want is someone going into cardiopulmonary arrest or stop breathing, heart stops, and you don't know what to do. And as a doctor, I would feel really bad not telling my family what to do in those scenarios. So I think that is quite important. Very basic training, but it can save lives.
Speaking of the pandemic, we know that 2021 has been a very difficult experience for the whole world. It's been unprecedented. The most sophisticated health infrastructures could not predict what COVID-19 has brought about. Now, if I was to be zooming into COVID-19, especially in the UK, we know that the British Bangladeshi community, who number quite significantly, particularly in the city of London, if you like, and then when you talk about the overall population, the British Bangladeshi community is less than 1% of the population. However, they were affected twice as much as anyone else. Now, as British Bangladeshis, and particularly many are Muslims, as well as from other faiths within Bangladesh, where they originate from. What is it? What's the reason for them being affected twice as much than the host community?
So Public Health England did a lot of research at the beginning of the pandemic to look at the incidence of mortality, i.e. death and serious illness, and they found that, as you rightfully say, the Bangladeshi community, the Asian community have been hit hard, particularly the Bangladeshi community. The Afro-Caribbean community have been hit hard as well. With regards to the Bangladeshi community, it's not just Bangladeshi, Pakistani as well. One of the key things which the pandemic has done is highlighted the gap between healthy and unhealthy individuals. It's kind of broadened that gap, and it's become more obvious through higher death rates and morbidity rates in the Bangladeshi community. So the key factors which they found in that piece of research is that, first of all, Bangladeshis and Pakistanis have the highest rate of cardiovascular disease. They have the highest rate of diabetes. Hypertension or blood pressure is very high, but that's high in the Afro-Caribbean community as well. These chronic diseases have been kind of raging through our Asian, Pakistani, Bengali community, and that's played a significant role. So that's been seen as one of the major reasons. Secondly, with the pandemic, obviously infection rate and spread is a key thing. And Bangladeshis, Asians, or Muslim in particular, they like to live in a multi-generational family. So with the grandchildren, individuals, the parents, grandparents, so 3 or 4 generations together. And when you live in that environment, one person bringing the virus in can spread through the family. So that means the infection rate has certainly gone up. Socio-economical status obviously plays a role, so people from a more affluent environment tend to do better than people from a dense population, socio-economically deprived. So East London, which has a large Bengali population, has that issue as well. So these are the main factors which they found why Bangladeshi people in particular with the chronic disease have fared so badly with the COVID, with a very high death rate.
For those who've just joined us, Ramadan Mubarak, Ramadan Kareem, you're watching the community show. On behalf of the East London Mosque, this is Ramadan Online, bringing the masjid to your house. So definitely stay connected. There's something for everyone online with the East London Mosque. Coming back to Dr. Kamali and speaking of deaths, I know that the community in England, if you like, particularly the BAME community, and then, if you like, within the Southeast Asian community / Muslim community, we lost a lot of first generation members, people of my father's age, your father's age, mother's age, that kind of age group. And from what I understand, and I'm sure the audience will appreciate, these were people who were not only figureheads of our own families here in this part of the world, but they gave everything to their families back home, wherever that is, particularly Bangladesh, India, Pakistan, and places like that. Now, they sacrificed so much, but it seems like they sacrificed their health so much that when they really needed the health, it wasn't there for them. What were the issues for such an age group? Why did we lose so many elders in such a short amount of time so quickly?
So from the pandemic point of view, and the reasons why people died, and the group which died the most were the elderly population. So by definition, being elderly puts you at a higher risk, mainly because your reserves are less than a young person, and particularly our elders, our fathers and mothers who may have come from Bangladesh, Pakistan, India. They've sacrificed a lot. They've worked day and night, earning money, raising us, making sure we're raised properly, we're fed, we go to good schools, we're taught properly, Islamic and culturally, and they've done everything to make us into good human beings. I am here today because of my parents, without a doubt. I know where I would be if my father hadn't concentrated everything on my well-being. So yes, we owe everything to our parents. Now, because of the hard work and the focus on us, they didn't focus on themselves. So they didn't do exercise, they didn't eat healthily, they were looking at ways to save money and yes, give back to the relatives in Bangladesh, but also look after us. So we were their focus, their health wasn't. So lack of exercise, lack of diet, sometimes they didn't go to the doctor because they didn't have time. So these things meant that they ended up having chronic diseases, so diabetes, blood pressure, hypertension, cardiovascular diseases. So that made things worse, and hopefully our generation will learn from that and stay healthy, eat healthy, exercise, so we don't end up in that situation. Because of those chronic diseases, unfortunately, the age, chronic diseases, and living where we live, very dense populated areas, that's contributed to, unfortunately, the a high death rate.
It's a great opportunity to, in this month of Ramadan, to actually ask Allah subhanahu wa ta'ala to forgive our deceased, particularly our family members and elders who have passed away. May Allah subhanahu wa ta'ala forgive them, accept them, and give them the highest of Jannah al-Firdaus. And for those families who've lost family members, may Allah give you unlimited patience and gratitude, and may you become, through your words and deeds, their sadaqah jariyah. It's your opportunity to give back. You're not going to be able to give anything materially back, but anything good you do, if, for example, if you give charity as sadaqah jariyah, if you make dua for them, these are all what they're looking for, those who have passed away. May Allah accept those who passed away through COVID-19 as shuhada, inshaAllah. Now, just to say to the audience who are watching this program, Eastern Mosque seeks to bring Ramadan online. Wherever you're watching from, we have something for everyone, inshallah. So make sure you stay connected, and we're going to be bringing the masjid to your house, inshallah. So this is the community show. I'm here with Dr. Abdul Wadud Kamali, talking generally about the overall health, and then we kind of zoomed into some of the issues around COVID-19. Now, in terms of health issues between men and women, particularly within the Muslim community, locally, I suppose, even globally, wherever people are watching from, are there some key distinctions between men's health and women's health that people should be aware of?
So generally speaking, between men and women, generally speaking, obviously men have more incidence of certain things, women have a high incidence of certain things by being a female person. So things like ovarian cancer, if you talk about cancers, breast cancer, so we need to be vigilant about those things. From a Muslim perspective, and Asian perspective, I think one of the key difference which we found is that there's a higher smoking rate amongst especially Bengali men compared to women, and I'm sure within the Asian community as well as Muslim community. It may be a cultural thing, but it is certainly high. That leads to so many problems, including all the chronic diseases which I've mentioned: diabetes, hypertension, cardiovascular, and also cancers, issues with the lungs, so COPD, asthma. So this is a big difference between men and women. The other thing which we need to be aware of is vitamin D. I know it's not highlighted as a big thing, but in our parents' population where women tend to stay at home, are covered all the time, and given that they are generally from the Asian subcontinent or Middle East, they have low vitamin D. Now, is that important? That's important because it affects your whole body, but it's actually more important during COVID times, because there has been some research which has found that there's a link. People who fare worse have a low vitamin D. Now, that's not saying low vitamin D causes more deaths, but there is certainly this initial association. either way, vitamin D is linked with many other diseases, and even the government has said all of us should take vitamin D during the winter period, and people of higher risk, i.e. Asian community. So there is a difference because women tend to go out less. Certainly our parents' generation are covered most of the time. So that's something certainly to think about. Men as well, but more so in women. So these are the two main things which I can think of.
So I mean, if you talk about women, and particularly Muslim women, we're talking about Ramadan here, we're not necessarily expecting, because of the lack of exposure to the sun, if you like, you're talking about vitamin D, and also being more indoors and perhaps less outdoors. Of course, it depends on circumstances. What else? What other way can they take vitamin D? Can they take vitamin D tablets? Would that add value to having vitamin D?
So yes, so in the UK we don't have much in the way of sun, so you will be lucky to have a good sunny day. So yes, vitamin D tablets. You can get vitamin D tablets over the counter, 1,000 units, very cheap to buy. Any brand is fine, so get the cheapest one. Definitely take that on a daily basis, 1 or even 2. It's completely safe, but it will certainly take away a lot of your aches and pains, joint pains, and generally affect the other kind of disease processes as well. So you can buy over the counter. I tell my patients, look, go and bulk buy 15 or 20 packets and just take them on a regular basis. But certainly I find patients who have certainly felt much better, all the aches and pains have gone away because they've actually topped up the vitamin D. So tablets are completely fine.
As Muslims, we know our faith emphasizes on the importance of what we put into our stomach, as in food. And we also know the importance of exercise, being active. And also cleanliness. Hygiene is a very big thing within the Islamic teaching and framework. We know that all of those 3 factors came to play a big role, if you like, in this current crisis, where people's neglect of their diet has added another layer to that difficulty. The lack of exercise, the lack of cleanliness. We realize the value of cleanliness. As Muslims, we're trying to clean ourselves, if you like, 5 times a day, and then we have even more specific cleaning hygiene requirements as well. Further, now how can we actually ensure that we are maintaining a good diet, we are maintaining exercise, we're maintaining cleanliness? Because the thing is, sometimes what happens is some people could be very good at exercise, but they're not great at diet or being clean. How do we bring about a more comprehensive effort in terms of being more sincere to our health?
Sure, absolutely. I think you've picked on a few key points: diet, exercise and cleanliness. Certainly from a pandemic point of view, I can see the links. So a poor diet would lead to chronic disease, which in itself leads to higher deaths in the Asian population. Cleanliness as well, as you mentioned. So it is one of the key things about the COVID pandemic, transmission of the virus, and preventing it through washing your hands, keeping the distance. So absolutely. And of course exercise. Now what can we do? So from a diet point of view, it's about eating healthy, eating regularly, not missing meals, not overeating, so eating moderate amounts, making sure you have a varied diet, protein, carbohydrates, fruits and vegetables, your 5 fruits and vegetables a day. Unfortunately, in our Asian communities, so Bengali, Pakistani, Indian population, rice is something which is a staple diet, chapati, because we eat it on a regular basis 2 or 3 times a day. That can lead to more diabetes, unfortunately, so maybe cut down on that. Make sure you don't eat too much fatty food with Ramadan. We know during iftar it becomes a feast, and sometimes I
can see some signs of guilt on your face, Doctor.
I have to admit, I do have my feet, but one thing I've done for the last 15 years actually is invested in an air fryer. So what that does is there's no more frying in our family. So we have our meals, but it's all air fried. So that's taken over a lot of problems. But we need to make sure low fatty food, low oil, carbohydrates, less of that, but a mixture of diet. So diet is very important. It goes on to maintaining your weight. So make sure you control your weight as well. Again, weight is going to be a big factor, so exercise is very important, keeping your joints very healthy. Again, weight loss, and exercise leads to a healthy body and a healthy mind. And mind is very important nowadays with a stressful life, with work, family. It's important to maintain a healthy mind, and therefore exercise will certainly help. And with, as I said, with cleanliness, it's part of our religion, and it will certainly help us deal with the pandemic and general life. So poor health, we know, is linked to more disease, and we do want to prevent disease, and staying healthy is certainly a good way to go forward.
Definitely, prevention is better than cure. For those who've just joined us, welcome, Ramadan Mubarak, Ramadan Kareem. We are here on the community show with East London Mosque, Ramadan Online. It's staying connected, bringing the masjid to your house. So wherever you're watching from, don't forget to like, share, comment, and of course subscribe and press the bell icon for any new notifications. Now, Doctor, just shifting the discussion a little bit to the next generation, second, particularly more third and fourth generation, and a bit more, we've talked a lot about physical health. I think mental health seems to be becoming a concern, and when I look at it, I think mental health will become even more of a concern, particularly screen time. Now, the level of exposure that we are having to screen is absolutely amazing. It's unprecedented. We've never had this level of exposure to screen time, whether we can have a 1-year-old child wanting a mobile phone, to my mother who's now fascinated with YouTube, if you like. I'm sure other elderly family members who've discovered YouTube, and they're asking you funny questions about it. Think, oh mum, you're like 70, what do you want to know about this video, that kind of thing. The thing is, are we going to see, and are you seeing as a GP, issues around technology and its impact on people's health, particularly something like screen time?
Yeah, obviously over the last 15-20 years, technology has moved on. It's gone from kids sitting at home watching TV to now kids on the iPad or the iPhone and spending a lot of time. When I was a young child, it was all about come back from school, go out and play football until it's dusk, and we had to be shouted back in. But obviously things have changed, so my kids and all the children I see, all my patients, it is a big issue because they spend a lot of the time with the iPhone, screen time, and as a result of that, they're getting addicted to it, unfortunately, number one. Number two, they're not exercising, so that's having an impact. As a result, they're gaining weight. Number three, mental health. So it's because they don't have the social interaction with other kids, they're finding it difficult to interact in school as well, and that's affecting them. Number four, screen time, but what are they watching? And sometimes they have access to really harmful content. It's absolutely crucial that we kind of filter that. If they have access to the phone from a very early age and they have access to communication with their colleagues, there's a constant pressure from social media like Facebook, Instagram and other things to have the perfect life. So when they see people having the perfect life, going on holidays and being very happy, there's a constant pressure to be like them. There's always the opportunity or the situation where they can be bullied online. And we don't realize this, and this is a hidden problem where children are bullied, so depressed the parents don't even know about this, and there have been sad cases of suicide. So these are hidden things which really need to look into. If mums and dads can put in filters, monitor what the children are doing, monitor whether they interact with other people, whether it's other adults, we have to be very, very careful. So this has opened up a whole new world, and it has to be monitored. Of course there's positives. We can do online lessons now which we couldn't before. There's lots of learning material, easy to access, but there's a more darker, difficult side we need to, and coming back a bit, yes, more screen time means staying at home more, no exercise. And it's affecting their vision, their mental health. So we have to kind of look into this. This is just the children's kind of side. Then we've got our working life. With the pandemic, it's Zoom meeting after Zoom meeting after Zoom meeting, and we need to start thinking about putting a limit to this, and it's going to affect our mental health as well because we're staying home all the time. So we need to actually look at that as well.
Dr. Abdul Wadud Kamali, thank you very much. Just before we wrap this up for this show, I just want to ask you, we're in Ramadan, people are fasting from all over the world, they're watching from all over the world. If there was one health advice and I could give you 30 seconds for, what would that be?
One health advice is think about the month of Ramadan as a month of blessing where we can use this to start living healthily if we're looking at health. So stop smoking. Use this opportunity to stop smoking, full stop, because this causes so much disease and disability. Start eating healthy. So eat healthy and carry on with the habits of eating healthy. Fasting has benefits, so even though you're fasting for the whole month, afterwards try to do nafil fast, which will certainly help you. And weight becoming an issue in our society, obesity, that will certainly help. So my key issue is use the month of Ramadan to develop good habits, good health, and sustain it throughout the whole year.
Thank you very much, Dr. Kamali. Brothers and sisters, you're watching the community show with the East London Mosque Ramadan online. Staying connected and bringing the masjid to your home. Inshallah, we will be talking very soon in the next segment on diabetes, which is impacting people all over the world. So wherever you're watching from, don't forget to like, share, comment, and of course subscribe and press the bell icon for notifications. So we will see you once again. Thank you. Jazakumullah khair. Ramadan Kareem. Assalamu alaikum wa rahmatullah.
Assalamu alaikum. The East London Mosque and London Muslim Centre has been providing vital services for our community for many, many decades, be that religious, social welfare or educational needs. During the COVID-19 lockdown, the masjid was shut for almost 5 months. And subhanAllah, what a testing period this was for many of us.
During the lockdown, we managed to provide many vital services for the community. For example, online Islamic talks, advice and counseling by phone, food bank, medicine delivery, and support for burials.
As you know, government restrictions mean that we are currently operating at reduced capacity. This has meant, like many organisations, the mosque's income has significantly reduced. The mosque needs your support now more than ever. Please do consider setting up a regular donation and a standing order. You can do this by visiting our website. Thank you so much. Assalamu alaikum.
Ramadan online. Stay connected to the East London Mosque.